morning, everyone. Molly Smore here live at our alert desk this morning. Joining us is Dr. Rachel Ogden from she's the Dean of the Leecom School of Pharmacy. So, Dr. Rachel Ogden, tell us just a little bit about just the importance of you being here answering people's questions throughout the morning.
Sure. Well, we're so happy to be here, and we'll have people from Leecom Health here throughout the day. But I think that it's important because as we continue through the pandemic, people need to be informed about, what is the truth, with the vaccines and with the disease, what they should consider about their overall health. And as a pharmacist, I'm concerned about individuals and them taking their medications properly and getting the vaccine and just, staying healthy.
And we were talking about earlier on live, but just tell us, if someone's afraid of needles, when can we expect the Johnson & Johnson shot to be coming out?
Well, they have not yet received the emergency use approval. I heard that they're going for it this week, so we're waiting to hear. And they say that they'll be ready to distribute 20 million vaccines by the end of March. So, I really encourage people to get a vaccine as soon as they can, no matter which manufacturer, because they've all been found to be safe and effective. But if it's no vaccine or waiting for the Johnson & Johnson vaccine, it's a one-dose vaccine, and hopefully soon, hopefully within the next few weeks to the month, we'll have it available.
And we have another question coming in. What can you do if you have a reaction to the second shot?
Okay, so there's a difference kind of between a reaction and a side effect. So reactions that we typically see are reactions at the local site in your arm, and you may have a little bit of redness, some swelling, and that's typical. It's good to kind of move your arm around after you receive the vaccine and just kind of distribute the drug through the body that way. Side effects, though, are a little bit different. Side effects are the things that you hear people maybe feeling a bit weak or feverish. And once again, that's typical. Although it's not recommended that you take anti-inflammatory drugs prior to the dose of the vaccine, if you receive the vaccine and you're having some mild side effects, it's fine to take them afterwards, to you stop those side effects from occurring. But all of the side effects that we've seen have been mild, and especially in relationship to getting the disease itself.
We have another one that says, I'm on an insulin pump. Would it be safe for me to get the shot?
Sure. So, especially if you have a chronic disease, like diabetes, you're more at risk for some of the problems with COVID. Now, if you have a specific, problem, or there's something special about a particular patient, always consult your doctor, talk to your pharmacist if you have any questions at all, because I don't know this individual's situation, but there's no contraindication for that.
Awesome. And then, will children ever need this vaccine, and how they figure out if it's yearly? The reason why we're not giving it to children now is because it hasn't been tested or approved in children. So it's 16 and up for the Pfizer vaccine, age 16 and up, 18 and older for the Moderna. And the companies have already begun talking about testing in younger populations. So, just like with the flu vaccine or other vaccines where we have found out more through time and through testing, eventually we will probably, do the same, or we will do the same when it comes to the COVID-19 vaccine. I can't predict what the time span would be, but I'm sure that just as with other vaccines to help prevent the disease, especially at-risk populations, that the children will be given it. How do you achieve herd immunity if the vaccine does not stop transmission of the virus?
Well, we don't know that it doesn't stop transmission. We don't know to the degree in which it stops transmission. So the one thing that we don't know is, how much after when you receive the virus. And the thing is, because of time will tell with all of these things. But herd immunity is just the matter of the population not being susceptible to the virus itself. So if
even if there is a chance that you can carry it or transmit, you're not susceptible to yourself. So, between 70 and 90% of the population being immune is when we receive herd immunity. So that's kind of the answer to that question.
All right. How long does it take to start fighting the virus? 6 to 8 weeks. That's the question.
How long does it take to start fighting the virus? Well, it is said that when you receive the vaccine, after about 1 month, you have immunity. So that's what I've read.
And then a lot of people I know have questions about vaccine, and if you're pregnant, is it safe to get the vaccine while you're pregnant?
So once again, because it hasn't been tested in a lot of populations, because of the fact that we needed to get it out and get going quickly, it has not necessarily been approved in pregnancy and breastfeeding because we don't have the studies. However, it is very similar to other vaccines. It has been tested like other vaccines. So pregnant individuals are receiving the vaccine. The most important thing to do, once again, is to talk to your physician if you are pregnant and see what they recommend. So there has not been found any problems or issues with pregnant women. It's just the fact that it hasn't been tested.
Okay. Let's see. I know, too, you were talking about just your overall health is so important. What have you guys been seeing just over the last year during the pandemic?
Well, one thing that we really saw kind of over the summer and into the fall is that, people weren't going out, obviously, but they weren't keeping up with their regular immunizations. So we've really been trying to encourage patients to make sure that they get their prescriptions refilled, keep up with your regular immunizations, keep up with your physician appointments. If you can't go in to see a physician, many physicians are now doing telemedicine so that they, can talk to you and at least see you face to face. And the at-risk populations are the elderly, obviously people with chronic diseases. Those are the individuals that take the most medications and need the most medical care. So, make sure that, we all keep up with our health, but if you have an older loved one that needs assistance, please make sure that they keep up with their medications.
I guess just talking more about that, just like prescriptions in general, making sure to stay up to date with those you were talking about, just how crucial is that, especially during a time that, coronavirus is going around?
It's really important. So right now we're doing a campaign in the School of Pharmacies called Script Your Future, and the whole point of the Script Your Future campaign is to make sure that patients adhere to their medications properly. Statistics show that 3 out of 4 patients at some point don't take their medications as prescribed. So that can lead to increased hospitalizations, increased complications, and especially a time when we're so worried about the pandemic and just getting ill, we want to make sure that our health is the best it can be.
Awesome. And we talked a little bit more about the Johnson & Johnson shot, but just going off a little bit of that, the 1 versus 2.
Yeah. So the whole purpose of receiving a vaccine is to build immunity against a disease. And so some vaccines can do that in 1 dose. Other vaccines take 2 doses to build that immune response. So that's basically the only difference. It's not that one is necessarily better than the other. So, if the thing about the 2 doses is it's taking us a bit longer with 2 doses because you also have to wait another month to get that full immunity, or the dose that will achieve that full immunity. So once we can get the Johnson & Johnson vaccine out there, people will become immune quicker because once we inoculate them the first time, then, they're good to go. So once again, none of them are better than the other per se. It's just, what fits your need and how can you get it as quickly as possible? What's available?
And when it comes to the second dose, a lot of people, might not know if it's going to be, if they get it that timeline that it's going to. How important is it that you get it within that timeline?
Yeah, it's pretty important. So, whenever you receive your first dose, you get a schedule card and they tell you when to come back for that second dose. But, things happen. You may, for whatever reason, if you're not able to get there on the day scheduled, still get the dose as soon as you're able to receive it.
And then when it comes to also getting it, if you're feeling ill, if you're stuffy nose, should you be getting the COVID vaccine that day?
Well, so they will, when you go and receive a vaccine, they'll always ask you a series of questions. You know, how are you feeling that day? If you just have some minor symptoms, you know, then it's not an issue. If you're very ill, then you should wait until you're feeling better to receive the vaccine. But, you know, check with your physician, check with your pharmacist. They'll ask you also, you know, the day that you go there, how you're feeling, and they can kind of assess the situation.
And a lot of people are just wondering how to go through what's the process look like when you go to get a COVID vaccine? What will people be seeing as they arrive there?
Well, so we have a variety of different scenarios going on. You know, we have some of these mass vaccine events and some smaller events, but usually what happens is, you know, you go in, you sign in, you answer the questionnaire, then, you know, depending on the number of people there, you'll wait. I mean, obviously, we still have you social distance and do all of the things that we would do normally. After you receive the vaccine, you wait 15 minutes. If you've had reactions to vaccines in the past, maybe they'll ask you to wait a little bit longer, and then you go on your way. So it's a very simple process, and people, you know, we've been able to get people moved through pretty quickly.
And what are some of your most asked questions people are asking you, you know, daily about the vaccine?
A lot of them, you know, have to do with, you know, do I really need that second dose? And we kind of talked about that. You know, they're concerned about side effects, and the side effects really do vary from person to person. And I can't stress enough the importance of the vaccine and the benefits of the vaccine versus some of the minor side effects you may feel, and they resolve, you know, within 24 hours. So, you know, it's really, really important. And then, you know, people do also say, you know, give me the comparison from vaccine to vaccine. And from everything that I've read and everything that I've seen, they're pretty equal. So it's a matter of getting the one that is available to you quickest.
I guess, is there any advice to people, you know, searching for an area to maybe get the vaccine? How's the best way to go about that?
Yeah, that's another good question, because aside from just asking questions about the vaccine itself, people are most concerned about how do I get it. So Leecom Health has been holding vaccination events at the convention center, the Bayfront Convention Center, on Mondays and Thursdays. This week I think it's Monday and Wednesday because of the availability. But there's a number you can call, 1-866-LECOM-19, or you can go to lecomisaging.com and get registered. So that, you know, that's what Leecom is doing. Other health systems are doing the same thing, having various events or ways that you can get in touch with them. I know that there's been issues with the massive amount of phone calls, but we're transitioning to a call center, so people will get to talk to someone, and they'll find out whether or not they can get an appointment or get on a waiting list. One thing that also has been recommended, I know people sometimes want to get multiple appointments because they're afraid, you know, maybe if I go to this site I can get in quicker. So if you do schedule yourself for multiple appointments with different health systems or different locations, once you receive your vaccine, just make sure you remember to go and cancel the other appointments just to free it up for other individuals. But everyone has been working very hard to distribute the vaccine as quickly as we can. Leecom has also been working with the health department. You know, we've been working with the housing authority just to get out and, you know, go to places that perhaps, you know, people aren't able to come to us.
And I know a lot of us, you know, this pandemic, it's almost been a year that we've had to wear a mask and all the restrictions. Just the importance of still following those every single day, even though you might be tired of it, it's still something you have to do. That's
the hardest part. That is really the hardest part. But, you know, it's kind of the least we can do to kind of protect each other. If you look at the number of deaths across the country, in Pennsylvania, in Erie County, it's just so important that we continue to mask, wash our hands, and social distance. Three simple things that make such a world of difference.
And then a lot of I don't know, this is something you could answer, but double masking is a big thing right now. Should people be doing that, or is it just important to properly wear your mask?
No, that's what's recommended. So what has come out from the CDC is that perhaps
2 cloth masks are more effective than 1. So that, that is the current recommendation.
Let's see. Someone said 16 and older with qualified conditions is the new line. With who can get the shot? 16 and older with.
Oh, okay.
Right now.
So I'm sorry. So that, again, I want to make sure we're talking about the same thing. So the drug is approved for ages 16 and older, but as far as if you're asking about who's
qualified right
yeah.
now.
So, we're in the phase system in Pennsylvania, and 1A includes people who are 65 and older, people living in nursing facilities, frontline workers, and certain individuals. If you have certain conditions, you may qualify. So yeah, I don't want to get confused as far as who the drug is approved for, and under our phase system, who should receive the vaccine first.
Maybe some people might be afraid of getting the COVID vaccine. What are your thoughts to tell them?
So I understand. I don't want to minimize anyone's fear. Individuals have fear of needles in general, or but I guess I think you need to talk to your trusted healthcare professional. You need to think about the risk versus benefit, and hopefully you'll consider receiving the vaccine. I can't brush away individuals' fears, but I guess I just want to say that you don't have to look at the needle when you can sit there and not look at the needle. I've received the doses because I'm a healthcare worker, and it was pretty pain-free for me. But everyone is different, so I don't want to minimize it. But I just can't encourage people enough to receive the vaccine.
Awesome. Well, we're going to be on live just in a few seconds on Erie News Now Sunrise, so we'll just take a little bit of a few second break here, and we'll be back as soon as we are on there. Hey, good morning, Mark and Brissa. Well, joining me this morning is Dr. Rachel Ogden, the Dean of the Leecom School of Pharmacy. And we've been answering people's questions on Facebook all morning, but one of those questions was, if I have a reaction to the second shot, what can I do?
Well, so, reactions do vary, and there's a difference between a reaction and a side effect. So mostly what we see, if you want to talk about reactions, are just what we call local reaction at the site of injection. You may have a bit of redness, you may have a little bit of swelling. A side effect is a bit different. So that's when your body starts fighting or developing this immunity towards the disease, you may experience a little bit of a fever, some achiness. Although it's not recommended that you take anti-inflammatory drugs prior to receiving the injection, if you do have some of those side effects or a bit of a local reaction after you receive the injection, it's fine to take some Tylenol or ibuprofen.
And then another question was, someone's on an insulin pump, would it be safe for them to get the vaccine?
Sure. So this brings up a good point about individuals with chronic diseases. So if you have diabetes, hypertension, respiratory problems, these are the individuals that are at high risk for complications related to the disease. There's no contraindication or problem with individuals that either have diabetes or on insulin pumps. If you have a special situation, I always say, consult your physician. But there are no issues with individuals on insulin pumps receiving this vaccine.
Great. Well, thank you for answering so many questions. Again, we'll be on Facebook throughout the show also. Live answering any of the questions that you may have, but we'll send it back to you guys in the studio. Alrighty, we're back here on Facebook Live. Just tell us a little about yourself and why you're here with us this morning.
Yeah, so good morning. My name is Marin Horn. I am a second-year pharmacy student at Lake Erie College of Osteopathic Medicine, Leecom. We've been talking with my dean this morning, Dr. Ogden, and answering some questions. So one of the great things that is happening at Leecom, she mentioned it a little bit, is the Script Your Future National Campaign and Challenge. So this challenge actually is a part of a campaign run by the National Consumers League. And what we focus on is actually working with disease states that are highly susceptible to certain things, chronic conditions that require medication for the long term. So things like diabetes, cardiovascular diseases such as hypertension, respiratory disorders such as asthma and COPD, things that need long-term care and is really important when people take their medications. So one of the things we focus on is educating patients, educating providers, doctors, pharmacists on the best ways to help their patients and help themselves on managing those conditions. So we really educate our community, we educate patients, we educate providers. We're really involved with this campaign. So that's why I'm here, is that every year we do this campaign. We've been recognized since 2011, so what a lovely 10-year anniversary for us during a pandemic. And originally, actually, we weren't going to do this campaign because we weren't sure if we could be involved in the community. But actually, Dr. Ogden really wanted to emphasize with us and bring it back because it's so important this year with the pandemic. So that's what we do, and that's why I'm here, and it's really awesome that we're able to be here.
And it's just the emphasis on making sure you go to those routine checkups and are taking your prescriptions every day.
Yeah, absolutely. And especially this year, a lot of people are afraid to go to their doctors, or they're maybe seeing them only online. And so one of the most available healthcare team members is the pharmacist. So when you come into the pharmacy, you might actually see me since I work most weeks. We can talk to you about the things and concerns that you have, so we can make sure you're doing well on your medications, your blood pressure, your asthma, everything is controlled, and that you're getting the proper care that you need. So that's one of the awesome things, is that we're able to make sure you're still doing okay, even if you can't go out. So
perfect. Well, thank you so much for waking up and joining us this morning. I know waking up is a little difficult, but we'll be back with Dr. Rachel Ogden in just a few seconds, talking to her more about those vaccine questions. So keep them coming here on our Facebook Live. We're back here on Facebook with Dr. Rachel Ogden again. She's the Dean of the School of Pharmacy for Leecom. So we have one question here that says, how can I get a call back from Leecom to schedule an appointment? I'm considered high risk due to age.
Yes, so I want to say that, first of all, there have been a lot of calls, and we're transitioning to a call center to be able to accommodate more people so you can talk to a live person when you do call. If you did have to leave a message,
do expect a call back in about 3 to 5 days. So we're trying to get back to people as soon as we can, but about 3 to 5 days is the average.
Let's see. And then we were talking earlier just about the overall health. I think a lot of people kind of forget about that. We're all talking about the vaccine, COVID, but just the importance of going to those routine checkups.
Absolutely. So medication adherence is a problem in our country, whether it's a pandemic or not a pandemic. But, talking about nothing but COVID-19 for the past year, some people have kind of minimized or forgotten the importance of preventative health and just their overall health and well-being. So especially if you're elderly, especially if you have chronic conditions, please make sure that you're getting your prescriptions refilled, that you're taking your medications properly, that you're still following up, with your physician for routine visits, even if they're virtual visits. The connection is very, very important. And even maintaining other immunizations that may be indicated for you at a particular point in your life. So all of that is so important so that, you can keep up with your overall health in a time when we really are trying to mitigate this disease.
Someone else says that is it safe for diabetics and asthma? I have all of them and I'm always sick.
So is it safe to receive the vaccine? Yes, absolutely. Once again, everyone's situation is different, and if you do have any questions, you can consult your physician, you can consult your pharmacist, but we want individuals who have those conditions to definitely get the vaccine because we don't want you to be compromised.
Someone also said reading about the vaccine only gives you immunity for 3 months. What would you like to say to that?
Yeah. So what you may have read is that maybe when you receive or when you contract the disease, how long are you, how long is your immunity afterwards? And I've heard that in months. But when you look at the data related to the vaccine, they're saying that you could have protection from 2 to 3 years. That's what they're projecting. Now, of course, we haven't been using it long enough to know, but they're projecting 2 to 3 years. And what I anticipate as time goes on is that we will receive regular boosters for this vaccine as we do the influenza vaccine.
Great. We're going to be on air live in just a few seconds. So we're going to take a break for just a few seconds here on Facebook Live, but make sure to keep those questions coming because we have Dr. Rachel Ogden here answering them all morning with us.
So those 2 questions you just asked me would be good. Okay. The time of immunity and then the one with the conditions.
Perfect. All right, stand by. Good morning, Mark and Brissa. Well, joining me this morning again is Dr. Rachel Ogden. She's the Dean of the Leecom School of Pharmacy. And we've been talking all morning on Facebook. But one of the questions someone just asked is, I'm diabetic, I have asthma. Is it still safe for me to get the vaccine?
Absolutely. So, as always, if you have any questions about your particular conditions, you can ask your physician, you can ask your pharmacist. But we do want individuals with chronic diseases to get the vaccine because they need the protection, more than anyone, as much as anyone. So there's no contraindication for these things. The only contraindications have really been if you have some issue with the vaccines or vaccine itself, but nothing related to chronic conditions.
Let's see. And then another question we had was, reading about the vaccine that only gives you immunity for 3 months. Now, talk about this and just what that means.
Yeah, so that is not something that I believe to be true. I've heard that date range if you perhaps contract the disease itself, but the projections for the vaccine are perhaps 2 to 3 years, but we don't know for sure because not enough time has gone by or studies. What I think will be occurring is that through time we'll need boosters of the vaccine, and I don't know what date range that will be, but I do think it'll be an ongoing booster like we get for the flu vaccine. But I believe the immunity is much more than 2 to 3 months. It's more like 2 to 3 years.
Thank you. Well, Dr. Ogden will be with us on Facebook Live answering all those questions. So head over to our Facebook page to ask a few of those questions and see if she has some answers for you about any of the vaccine questions that you may have. Mark and Brissa? Alrighty, we can go back on Facebook now. So we have some more coming in. Let's see. We'll go through some of the questions maybe that we already answered. Vaccine and pregnancy is one of those big things that we know we've had a lot of phone calls about. Should people that are pregnant get the vaccine?
So the vaccine was not tested on pregnant women or breastfeeding women, so they can't say that it's approved in pregnant women. However, it's not necessarily contraindicated. This is a vaccine like other vaccines. Pregnant women should not receive live vaccines, but this is not a live vaccine. So we believe that it is safe in pregnant women. Many pregnant women have received the vaccine since it's been released. So the real thing is to check with your doctor and consult your physician as to whether or not they recommend it for you.
And then how do you achieve herd immunity if the vaccine does not stop transmission of the virus?
So herd immunity occurs when there are between 70 and 90% of the population that are immune to the disease. So you receive immunity two ways. You receive immunity by contracting the disease and developing immunity in your body, or by receiving the vaccine and developing immunity. So transmission becomes less of an issue, and we believe transmission also is decreased with the vaccine. So I don't want people to believe that there are still the same amount of transmission as if you received no vaccine at all. But the herd immunity will occur when we have all either had, that percentage have had the disease or received the vaccine.
And then we've seen a lot of people talking about scheduling multiple appointments for the vaccine. How important is it to make sure that you're not doing that because you're, maybe taking an appointment from someone else?
Yeah, and so I know how difficult it's been for some individuals to get through, to make appointments, and then, you may have an appointment that's several weeks out, and you think, well, maybe I can grab a quicker appointment, so I'll schedule a couple. And we understand that, and that's okay. It's just important that when you do receive the vaccine, that you cancel your other appointments that you've scheduled to free those spots up for people who are waiting for the vaccine.
We have another question coming in. It says, is MS an underlying condition?
Is MS an underlying condition? So maybe they mean an underlying condition for not receiving the vaccine. And so MS is an immune disease, an autoimmune disease. So that is one that you would talk to your physician about. Although it's not contraindicated, you should talk to your physician just to see what is right for you as far as receiving the vaccine.
Let's see. Just when can we possibly be seeing, children under the age of 16 able to get the COVID vaccine?
Well, currently it's not approved, for children. So once we start testing, and drug companies have already talked about beginning testing in younger individuals, once we see the testing and it's proven to be safe and effective, then I believe that children will begin receiving it also.
And a lot of people are having questions about teachers and everything in the area getting vaccinated.
Right.
I know there's other counties that are getting vaccinated in PA that are teachers. When could we be seeing maybe some of those people? Yeah,
it's difficult, and so you can go to pa.gov. You can look at the phases. You can look at who is approved for which time. Maybe some teachers are getting immunized. Maybe those teachers also have underlying conditions that qualify them for phase 1A. But right now, really in Pennsylvania, we are in the phase 1A phase, trying to do as much as we can, and just waiting for the governor to take us to that next phase.
And when it comes to the second shot, a lot of people might be nervous, but how important is it that you actually go for that second dose?
So important. So, the drugs have been tested. What they recommend is what will give you the best efficacy for protection against the disease. So getting that second shot is very important. Getting it as close to the date as you are supposed to is important. So you'll be given a date whenever you receive your first injection. If something happens, if you are very ill, or if there's something else that precludes you from getting there, it's still important to get that second dose as soon as you are able.
Then someone else is asking, can I get the vaccine now if my BMI is a 36?
So follow up with, there are questions that are being asked, and obesity is one of the underlying conditions that does put you at higher risk for complications from the disease. But what I would encourage you to do is, when you're making that call, if you call 866 Leecom 19 and talk with them, they can confirm whether or not they're able to immunize you now.
Awesome. And then someone else is asking where they can get more information about the vaccine lasting 2 to 3 years.
Oh, yes, you can go right on cdc.gov. There's information about the vaccine and the specifics about the vaccine, which is, where I get my information.
Great. And then we were talking just about overall health, too, when it comes to all of that. How important is it to make sure you're sticking with your routine checkups? Absolutely.
So just making sure that you're staying well, making sure that you take your prescribed medications, making sure that you're keeping up with your physician office visits, talk to your pharmacist, whenever you go and pick up your prescriptions, whether it's, you're able to get there in person through the drive-through or call them on the phone, but keeping your overall health up, to its highest standard is the best.
And then if you don't get that shot within that window of the second shot, do you have to start over, or is...
No. So it's, you just have to receive that second dose when you are able, and as soon as you are able, but there is no current recommendation that says you would start again from that first dose.
And right now, what is the age range and everything of the people that can get vaccinated in that 1A group?
65 and over, and then others, younger people that have certain qualifying conditions.
Just the importance of getting that vaccine when it's available to you. You might be a little bit nervous, or, you're like, oh, well, I'm not I don't get sick often, or just anything in general. Why is it so important to get that vaccine when it's available?
Well, a lot of people do think that I'm not going to get that sick, so I don't really have to worry about it. And it's kind of not just about you, it's about our community, it's about our loved ones. So the thing about the disease is that you can transmit the disease if you carry it and be asymptomatic for a number of days. So you could have infected many people that you come in contact with without really having the severity yourself. So to see the effects of the pandemic, the number of people hospitalized, the number of people dying, that's why we all have a responsibility, to become vaccinated. And even though we think that we may not get too sick, people have become very ill at all different ages.
And then we have another question that's coming, and it says, my wife is bedbound. She can't stand or walk. Can someone come to the house and give her a shot?
So what I would do is call the number and talk to an individual. If they have health professionals coming into the home anyway, because she's bedbound, there may be able to do something. But call your physician and ask and see how they can get it distributed to them.
I guess, is there any questions that you have been receiving that you think are very common or most people are wondering today?
The main questions that I hear are the differences between the vaccines. Is one better than the other? Some people, think that the Pfizer is better because it was out first, or, different things that they just hear in random conversation. But what is found to be true is that they're all pretty equal. And even though you may see a little bit of range of efficacy in the various drugs, like Johnson & Johnson has a little lower efficacy than the first two that came out, what they found is, as far as hospitalizations and deaths, which is really the severity of the disease, they're all equal. So the main thing is just to get the vaccine when you can get it.
And when it comes to the vaccine, even though you got your immunity, or you got your 2 doses of the shot, just how important is it that you're still wearing your mask and doing all the safety precautions?
So, we still don't know what the percentage of transmission is for how long after receiving the vaccine. And there's still a period of time when your body's building immunity. So, you have to follow the guidance of the CDC that tells us what to do. And so what they're saying is right now to continue all of the mitigation efforts, which is wear a mask, wash your hands, and social distance. And so the vaccine is so important, but these other measures are important too. And and they'll be around for a while. As long as the disease is present in the population, we'll have to continue doing it.
And then we've seen case numbers start to go down. Do you think that has an effect from the vaccine, or you think people are just following, the safety precautions more, staying inside with just their families?
Yeah, I think it's a combination because, at different times we've seen we've seen the spikes, for various reasons. So I think it's a combination of what people are doing as far as mitigation efforts. I think it's the number of people who have already had the disease and the number of people who are getting vaccinated. So it's all of those things. And hopefully it'll continue.
And then someone else said, can I still get COVID after I've received the vaccine?
Well, there is a period of time when you still may be able to contract the disease, perhaps, fresh after you were immunized. And the vaccines are said to be 95% effective. So extremely effective. 95% effective is very, very effective. So the risk is very low. But right after you received, so for sure, between the first and second dose, there's a higher risk because you haven't received full immunity after that second dose. And then there's probably a short period of time after receiving the second dose where your body just hasn't built that immunity yet.
Just what's your best advice if people are looking to find a COVID vaccine?
So as I said before, you can call 866 Leecom 19 or go to lecomisaging.com, and we're doing mass vaccination clinics. We're working with the Department of Health to distribute vaccine in the community and also working with the local housing authorities. Other health systems also have numbers that you can call or websites that you can go to. You can call your physician. So if you are having issues with finding them at those other places, you can call your physicians. One thing that I didn't mention that is important to mention, there's also a federal campaign with 21 different chain drugstores across the country that they will all be receiving vaccine and administering vaccine. So there's, as your local pharmacy, they're beginning to take appointments for vaccines. So think about your local pharmacy and ask them, if they are beginning to vaccinate yet. So the issues or the delays are, distribution. The supply has not always been, we haven't been able to predict. It's been a bit sporadic. I know we didn't receive doses last week, but are projected to get doses this week. And we've been able to keep all of our appointments, which we're very happy about. But any of your providers, your pharmacist, your physician, your hospital, just check those sites and see who's offering them.
Any advice to people that are maybe on edge about getting the COVID vaccine?
Yeah. So I'm guessing if you're on edge about the COVID vaccine, maybe you've been on edge about other types of things regarding your health. It's just you have to look at the data. You have to look at the science. The efficacy is very strong. The safety is very strong. We've been going through this for a year now, and the fact that we have a vaccine is so wonderful. So I would say talk to your trusted healthcare professionals. Ask them the questions in person. If you have a specific issue or thing that you're worried about, talk to them. But overall, I can't stress enough the importance of getting the vaccine.
I I know a lot of people are just wondering when, the next group will ever be able to get the vaccine. I know a lot of it has to do with the amount of doses the area is getting, but could we be seeing the next group anytime soon?
That's really up to the governor and the way that they're assessing the situation. So we do still have such a response for the individuals in phase 1A. So we will keep immunizing and keep going through those individuals. But I think once the flow of vaccine, is constant, and we see that we're keeping up with those that are most at risk, I'm sure we'll move to the next phase, but I can't predict when that would be.
And as warmer weather hopefully comes sooner than later, how could that play a role in, all of this, especially if a lot of people are outside not wearing masks or, safety precautions and different things?
So, as we saw in the summer, when you're at an open air event, you can social distance easier. And so that, that is a plus. But as we go into the summer and the nicer weather, we still have to remember that, all the things that we're being recommended to do still have to stay in place. So the masking and the social distancing and hand washing still has to stay in place. But being outside will give us more opportunity to do things, but we still have to social distance.
Hey, good morning, Mark and Barissa. Well, joining me this morning is Dr. Rachel Ogden. She's been answering all the different questions for us. She's the Dean of the Leecom School of Pharmacy. But we've been just talking about people are nervous about getting the second shot. Just how important is it that people go and get that second dose?
Absolutely important. So for the 2 current vaccines that are available, that second dose is what's going to give you that full immunity. So very important to get that second dose. If something happens that you can't be there on that exact day, make sure you contact the provider that's giving you the vaccine and make sure that you get there as soon as you're able.
And we also just have people just, wondering if they'll be able to get COVID after they get the COVID vaccine shot.
Yeah, so there is a period of time when your body is building that immunity, and so you could be at risk at that time to contract the disease. However, you build that immunity after the second dose, and the vaccines are 95% effective, which is phenomenal. So the risk is very much decreased with the vaccine.
And the most asked question that you get on the daily about the vaccine itself?
Usually people are concerned about the side effects, and because they don't know how they're going to react. And so, what I just tell them is that it varies, but side effects are minimal compared to the disease and the risks that you face with the disease.
All right, well, thank you, Dr. Ogden, for joining us this morning. Again, we'll be on Facebook answering your questions coming up just in a few more minutes. Back to you guys in the studio. Alrighty, and we have another question here. My parents are snowbirds and are signed up for their first shot in Arizona in March 19th. Can they get their second shot when they come back to the area?
You really should stay and get the shot where you receive the shot, because what is happening is that individuals are being allocated the vaccine according to first and second dose. So you receive so many first doses, and then you go and get that second dose. So it's kind of important that you're in the same location for both doses. Now, if they want to contact their pharmacy, back here and ask about that, they certainly can do that. But my first recommendation would be is to try to get both doses from the same provider.
And our last question of the day, just talking to us about when we could expect herd immunity and just the importance of going out and getting that shot.
So herd immunity is a bit unpredictable just because there's so many variables. So the variables are, who has immunity from the disease, who has immunity from the vaccine, and what percentage of the population has immunity. So the most recent thing that I've heard Dr. Fauci say is perhaps December 2021. But if you look at various graphs that are put out by the CDC just predicting how many will contract the disease or how many immunizations can we give, that could range by months. So the most important thing is that we all do our part to get vaccinated so that we do develop that herd immunity as much as possible.
Awesome. Well, thank you so much for joining us this morning for an hour long. We'll be with you guys all throughout the day. We'll have other local experts in talking to you guys, just answering all those questions that you might have about the vaccine. So be looking out for that. And as always, you can ask your questions on our Facebook page, and we'll try to get those questions answered for you.